Hello girls, hello to all the mothers, and hello to all the women out there. Once again, I am Douglas. Welcome back to my channel, your channel, womensworld.ph. So before we start, please like and subscribe to our YouTube channel and click the notification bell so you will be updated to all the health tips video that I will be uploaded weekly. So for today, we're going to discuss one of the topic that was requested by one of our subscribers, and that is about pap smear. And it was requested by Miss Yang Yang. Hi Miss Yang Yang! Shout out to Miss Yang Yang, and this video is for you. So we're going to talk about pap smear. I'm going to discuss to you the 5 frequently asked questions. Number 1 is, what is pap smear? And number 2 is, when should I start having pap smear examination? Number 3 is, what is the preparation that I should do prior going to the obgyne? Number 4, how it is done. Is it painful? And then number 5, what is the result? So what is pap smear? Pap smear is a screening test for cervical cancer. It is one of the screening tests for cervical cancer. And you know what? Cervical cancer is the second most common cancer that causes mortality or death in women. We are so lucky, we are fortunate that we have what we call the pap smear or the pap test to detect early stage of cervical cancer. Actually, aside from the pap smear or the pap test, we also have some tests to detect cervical cancer. And one of these is the HPV testing. Okay, we have the pap test, HPV testing. Number 3, we can do both, the HPV and pap co-testing. And number 4, we can do the VIA or the visual acetic acid. So for this discussion, I would only concentrate or focus about pap smear. So as you can see, pap smear is really very important because it screens cervical cancer. So it is also the easiest cancer to be identified through pap smear. So it's really important that all women should have a pap smear. So the next question is, when should I start, or who is the candidate of this pap smear, of this test? Before, it is recommended that pap test or pap smear should be done at least every year. Last 2018, there is an updated guideline that was released on when should we start or what age should pap test should be done. Okay, so it is recommended that women ages 21-year-old until 29-year-old have the pap test at least every 3 years. Okay, so if you are 30-year-old to 65-year-old, it is recommended that you have at least every 3 years pap test also. But if you don't want to have that test at every 3 years, or you missed the 3-year period, you should have at least co-testing with HPV. So pap test plus HPV co-testing at least every 5 years. Women who have high risk of cervical cancer, let's say she has a history of precancerous lesion from her previous pap smear, she is recommended to have pap smear at least every year or every 12 months. So what is this precancerous lesion? So this precancerous lesion is, if you heard about genital warts, okay? So if you heard about genital warts, if you are treated before with because of genital warts, so that is a precancerous lesion. That means you really have to have a pap smear every year. So who should not have the pap test? Okay, so if you are less than 21-year-old, it is not recommended that you undergo the pap test. Okay, and if you are more than 65-year-old and above, and previously you have a normal or negative result for pap test or a cervical cancer, you don't need to have the pap test on your 65th, 66, or more than 65 years. Okay, and then number 3, if you underwent total abdominal hysterectomy, or those women who had a surgical operation or a surgical removal of the uterus together with the cervix, you do not need to have the pap test, especially if the reason for the removal of the uterus is not associated with the cervical cancer or any cervical. I would like to repeat, all women, once you turn 21-year-old, regardless of the sexual history, you have to have the cervical cancer screening test or the pap test. Okay, so if you are 21 to 29-year-old, at least every 3 years you should have the pap test. And if you turn 30 to 65-year-old, you should have at least pap test again every 3 years. But if you don't want to have the pap test every 3 years, you can have it every 5 years, provided that you have, aside from the pap test, you have the HPV test. For the third question, what should I do prior going to the obgynecologist? Okay, so number 1, of course, you have to be very emotionally and psychologically prepared, because we doctors know we're having a hard time telling the patient, oh, you have to open your legs, because they're very anxious and they are not comfortable with the procedure. So you have to be emotionally and psychologically prepared for the procedure. Okay, and then number 2, you should not be having sexual contact for at least 24 hours. Okay, and then number 3, avoid douching. And number 4, you should not be menstruating. So you may reschedule your checkup to your obgynecologist for at least a week after your menstruation. So a week after your menstruation, you can have the pap test. Number 4, FAQ, or the frequently asked question, Doctora, how it is done or how the procedure is done?
You should be in a lithotomy position, lying down with open legs.
So I would like you to understand the anatomy of the female reproductive organ, so we will not be lost. And I want you to understand that we need to know what is our target. So this is the uterus. On a bigger picture, this is the uterus. Okay, and this is the cervix. This is the vagina. So what we need is only the cervix. We wanted to get a sample from this area. So how are we going to do that? We need a speculum, and this is the speculum. So the speculum instrument, it has different sizes. It has small, medium, and large. So depending on
the size of the depending on the size of the vagina. So we will choose what is appropriate for the size of the vagina. So it won't be painful for the patient, or it won't be painful to you. So we usually use a vaginal speculum that is sterile, and this is disposable. So this is a one-use speculum. As you can see, this is a disposable. It is made of plastic and it is transparent. So we usually choose what size is appropriate for the patient, or to the patient. So this speculum, we insert it inside the vagina and then we open it. Okay, so we can easily see the cervix. And so this speculum is a plastic, and this is not painful, don't worry. This is not painful. This will just cause you a little discomfort. So my technique in using this, I will ask the patient to bear down as if she is going to give birth. Usually in bearing down, the vagina naturally opens. So when the vagina opens up, I insert this slowly, or gently, and then I'll open this one. Don't worry, because this procedure will not take too long. Usually it will take like 1 to 2 minutes, then we are done. And so once the cervix is visible, we're going to insert this cotton swab. So we're going to insert it, and we'll just get a sample at the cervix, or the cervical mucosa. And then we're going to put this in a slide. We're going to wipe it here, the specimen, and then we're going to give it to the laboratory for the pathologist to examine it under the microscope. And once we're done, upon removal of this speculum, I usually ask the patient to again bear down, okay? Because naturally the vagina opens up, so it will not be painful for you. Don't worry, because the procedure will only last for like a minute. So this procedure is only a 1 to 5 minute procedure. So this will not cause you that much discomfort. And actually, after the examination, you will feel good about yourself, because you know you've done your part in taking care of your body. So you will just wait for the result for like 1 week.
So the fifth frequently asked question is, Doctora, what is the normal result for the pap test?
So this is the result of the pap smear. Usually the first thing that you're going to see is the adequacy of the specimen, and if it says that if there is an X on the satisfactory for the evaluation, and the normal result is the negative for intraepithelial lesion or malignancy. That means you are negative for cervical cancer.
So I hope that you learned something for today, and I hope you will not hesitate having an appointment to your OB-gynecologist. So when you visit your OB-gynecologist, aside from the pap test, you may also consider having the pelvic examination as well as the breast examination. So that ends our discussion for today. I hope that you learned something from our topic for today. So always remember to stay beautiful inside out and remain in the holy love of Jesus. For Jesus said, "For I know what my plans for you are, plans to save you and not to harm you, plans to give you hope in the future." Bye for now. Till next time.